a shocking spike in strokes among healthy young people. I'm Mark Dolan, good to see you. Now, do you remember the good old days when public health policies promoted public health? All of that went out of the window in the 1980s with the demonization of saturated fat, with top medics neglecting to notice that humanity has prevailed for 200,000 years on a diet of red meat, fish, and other animal protein. But it was suddenly decided by a clever scientist called Ancel Keys in 1978 that in fact the cause of heart disease was bacon, butter, steak, and even the humble boiled egg. Ancel Keys' very selective 7-country study into the risk of saturated fat cherry-picked the countries that supported his thesis and ignored the ones that did not. It's likely that the demonization of fat was partly encouraged by the tobacco industry, who was seeking to escape blame for the role of cigarettes in heart disease. But the die was cast, and so-called public health advice was geared towards increased consumption of carbohydrates, so-called healthy whole grains, bread, pasta and cereals, as well as starchy foods like rice and potatoes, plus the introduction of industrial seed oils like sunflower and rapeseed oil, which, whilst marketed as lowering cholesterol, are linked to inflammation and obesity. And by the way, they're completely unnatural. So here we are. It's the 1980s, and with natural fat now being bad, the food industry spot a potential gold rush, creating a whole range of low-fat products which removed the fat from items like yogurt and replaced it with pure sugar in order to make it edible. So how did the whole low-fat revolution work out? Well, a decade upon decade explosion in our waistlines. Low-fat made us fat, with obesity and type 2 diabetes, once medically rare, becoming the norm. And of course, what it also established is the processed food industry. That's right, we've been eating junk ever since, which is why it's devastating to read about a shocking spike in strokes among healthy young people. The alarming surge was identified in official UK government data. Now, the data shows that recorded cases of deadly strokes skyrocketed in 2023 and continued soaring this year. In 2023-24, the data, most alarmingly, shows more than 12,500 British people in their 50s suffered the life-altering and potentially fatal condition. By comparison, the figure stood at just over 8,000 in 2004. So the increase marks a spike of 55% in 2 decades. The trend far outpaces the 28% rise across all ages over the same period. Experts said the alarming trends showed that the condition is no longer just a risk for the elderly. But why would that be? What's changed? Now, processed food undoubtedly has a role to play here. Since Ancel Keys' low-fat revolution, we've never been sicker or fatter. Just look at photos of Americans or Brits on the beach in the 1960s. But with strokes among younger people soaring, establishment media is ignoring the elephant in the room, the COVID-19 vaccination program. Now, my main objection to the vaccine rollout originally was not the existence of the jab, which may have helped those in the vulnerable categories from succumbing to the worst aspects of the virus. Perhaps it saved lives, maybe millions of lives, who knows? My mind is open on that one. But the big problem in my view was the vaccination of the entire healthy population, particularly the coercive way in which it was done. And why is it that medics, for the first time in history, decided to treat people for an illness that posed the vast majority no mortal threat? The average age of death from COVID was over 80, and normally among patients with multiple comorbidities. Why we had lockdowns and paid healthy people to stay at home during the pandemic is one scandal. The economic damage now suffered by countries like Britain and America is ironically devastating for public health, given both nations' resources have now been depleted. A poorer country is rarely a healthier one. But the totalitarian policy of vaccine mandates, where access to a normal life and international travel and even keeping your job was predicated on having had the jab, And the whole idea of that policy was illiberal and against the values of Western democracy. But worse than that, it made no sense. It was illogical, as it became immediately clear that these jabs did not stop transmission. So the idea that you got vaccinated to protect others was a categorical lie. Now, if the COVID-19 vaccine was essentially like drinking a glass of water, I don't think most people would mind taking it either way, even if you didn't need it, and statistically, most did not need it. But this wasn't a glass of water. It was new technology, mRNA. The manufacturers were spared liability, which ought to be a red flag in its own right. And the jab came with known side effects, with certain countries, for example, withdrawing the AstraZeneca vaccine. Perhaps wise, if you look at the case of BBC producer Lisa Shaw, dead at the hands of the AstraZeneca vaccine. Now, that's not an opinion, it's on her death certificate. Her husband is now a widow and her son an orphan at the hands of a jab that statistically she didn't need. She was 44, slim and healthy. She was not in the at-risk category, and now she's gone. The vaccine has been linked to myocarditis, particularly among young men. Again, another cohort that were not going to be seriously threatened by the virus. Myocarditis is a serious heart inflammation that can cause irreparable damage. Why would you take that risk for a disease the UK government admitted a third of people would have no symptoms from? Given the vaccine provokes an autoimmune response in the body, this has led to debilitating side effects for many young, healthy people who probably shouldn't have had the jab in the first place. And now we're seeing a worrying spike in strokes among not the older groups, but among younger people in their 50s and beyond. These numbers aren't normal. Why aren't doctors and scientists looking into it? The increase in strokes marks a spike of 55% in 2 decades. But we can't be 55% less healthy. It doesn't make sense. And as I've said, the trend of strokes in those in their 50s and younger outpaces the 28% rise across all ages over the same period. Now, I'm happy for any link between strokes and the jab to be dismissed by a proper, honest look at the data. But that's not likely to happen anytime soon, as the medical and scientific establishment circle the wagons for fear that they may have blood on their hands. If they're so confident in the safety and efficacy of the vaccine, why not allow scientists who are not in the pocket of big food or big pharma or caught up in ideological groupthink to form a judgment? But at first glance, that's right, at first glance, it's not looking good for the medical authorities. As the Slay News website has reported, multiple studies have linked COVID mRNA vaccines to spikes in strokes, as well as blood clots, heart failure, and sudden deaths, particularly in young people. A major new study has also just linked COVID shots to surging reports of brain clots. That's right, the damning new peer-reviewed study confirmed that COVID mRNA vaccines caused a staggering surge in deadly blood clots in the brain. A team of leading American researchers found that the jabs carry a risk of brain clots that is over 1,000 times higher than the flu shot. The major study, involving one of the world's leading cardiologists, Dr. Peter McCullough, suggests that the shots have caused a staggering 112,000%, that's right, 112,000% increase in brain clots. Now, these stats come alongside a deeply worrying increase in some types of cancers, specifically breast, lung, and bowel, among younger people. So what is going on? And why was the entire healthy population pressurized to get vaccinated if it didn't stop you getting the virus or spreading it? That a third would not know they had, for almost everyone else a day or two in bed, just like the flu. Vaccine tyranny looks to have resulted from scientific groupthink, potentially fostered by a pharmaceutical industry eyeing the chance to make billions. Vaccinating the entire healthy population may simply have been a financial, not public health imperative. Why else would the UK government overrule its own vaccines agency, the JCVI, to jab children? Always follow the money. Now, Dr. Jay Bhattacharya of Stanford Medical School called lockdowns the biggest public health mistake in history. But if the jabs needlessly killed and hurt people, that is incompetence and potentially corruption on a whole new level, wiping out the credibility of an entire generation of medics, scientists, and politicians, not to mention celebrities and TV stars who demonized and shamed the unjabbed. Show me a country with low vaccination rates that suffered disproportionately higher COVID-19 mortality. Angola had a vaccination rate of 12%, but had half the excess deaths of the UK, 70% of whose population was jabbed. Vaccination in Congo was almost non-existent at 0.1%, but also boasted lower excess deaths than the heavily jabbed United Kingdom. Now, yes, there are population differences, but still, these African countries also have dense cities and far worse public health provision. Makes you think, doesn't it? The vaccination rollout might be the biggest medical scandal in history, or it might not be. But what we need now is a large injection of the truth.